Hi, this is Fix My Fibro, and my name's Bernadette, and I welcome anyone with chronic fatigue syndrome, long COVID, histamine intolerance, you name it, you're all welcome to listen to these videos. But the point of this video, this is a beautiful fabric that I actually, it's back to front. Let me fix it up. Excuse me. It's a bit of fabric because I like to sew, and it's a bit of fabric that I used to make bridesmaids' dresses actually years ago for my brother. There we go. Now it's all nice and shiny and beautiful. So, but the point of this video is to talk about how many functions, how many parties, how many social events you have missed because of your illness. And that's just devastating and deserves its own video. So, when you've had an illness for decades, I had a lady on social media this morning say, "Oh my God, I've had fibromyalgia for 50 years and I didn't know that about the histamines and the DAO levels." Yeah, because even though it's common knowledge in the scientific community, medicine hasn't caught up. The doctors aren't communicated or haven't been communicated or educated. That's the word, edumacated, as I call it. So the doctors aren't educated on it. So they're not telling you as a patient. My friend that has severe histamine intolerance said to me, she went to a doctor the other day and said, "Oh, should I eat a low histamine diet?" The doctor went, "Oh, I don't know, what's that?" I mean, it's pathetic. I'm sorry. No disrespect intended. But if the doctors are all so not versed in anything to do with mast cell activation, anything to do with this purinergic gouty issues, they'll know. The GPs will know when they watch this and say, "Oh yeah, I do get quite a few patients that say they've got fibromyalgia coming in saying they think they've got gout." But you know what? We do the blood-based diagnostic test for gout for men, the one that predominantly affects men, which is called monosodium urate gout. And, it's always negative. I had that test done. I've been having gout attacks since my disease started. We all have gout attacks. It causes severe pain alone from the cytokine issues and the mast cell activation. This is why it's such a disabling disorder. This is why it's so crippling. This is why you become a hermit in your own house. This is why your friends don't talk to you anymore. This is why you just have no more life anymore, because you are in a cycle of misery, of symptoms, because you're not diagnosed, because the doctors don't understand it. Even the research that's out there now that says we have low enzymes, low DAO enzymes, and you can take it as a supplement and that you should eat a low histamine diet. Do any doctors tell anyone with fibromyalgia that? Nope. So I'm telling you it. I'm not a doctor. I'm a scientist. But I'm telling you because I got my life back. I now go to functions. I went out to a dinner last night. I went out swimming yesterday at the pool, did a half an hour of swimming. I go socialize at my pool and my gym. I go out and I have an active, normal life again. I'm not saying it's easy. There is a lot of lifestyle changes you need to make, but it's actually not that hard. If you give me an option, do you want your old crap life back, Bern, when you were just about suicidal because you're living at home as a hermit for 2.5 years, didn't talk to anyone, wouldn't answer the phone, and you were so in pain that you were living on chronic amounts of painkillers and you wanted to just, end your life? Do you want that? Or do you want the life you've got now, Bernadette, where you actually, sure, you have to make a lot of dietary restrictions, you have to manage every you have to manage your whole life and every cell of your body to make sure that your disease is under control, but you can then have a normal life. As long as you do all those things, do I want this crappy life or do I want this fabulous, I got my life back? Well, yeah, I got my life back. I got my life back in 2007 when I figured out the purinergic issues, the purine issues, and that's why I wrote a book about it in 2010. And then, since then, it's been characterizing the MCAS. And that's what I've done. And so now I've got the full picture. I understand this disease intimately. I know what every single symptom is relating to, whether it's relating to this part of the illness or that part of the illness. If you don't understand the symptoms, you don't understand the disease. So I'm teaching you, I will talk about every single symptom, and you will get to put your beautiful gold lovely clothes on. You can, if you're a man, you can put your suits on and your nice shoes and go to a pub. Sure, you can't drink beer because that's a purine, but you can, I didn't drink alcohol last night. Alcohol is a purine, and it also sets off, mast cells. So alcohol, I'm sorry, I used to drink alcohol early on in my illness. In the first probably 5-10 years, I was a chronic alcoholic because, you think it fixes your pain. My grandmother used to drink a lot of alcohol to deal with your pain, but you don't actually realize it's actually causing more pain. So you're in this vicious cycle of purine gouty attacks plus mast cell activation. So, you soon learn, you know what, alcohol doesn't do it for me, and it just doesn't. So last night I had a glass. I can put my drink in. I can even put water in a wine glass and enjoy it, or I can have a soft drink, or, certain things in moderation, even though we're not supposed to have them, is okay. Because if you're under that threshold of your salicylates or of your purines, you can eat them without having a massive attack. It's when you go over that threshold. So this video, it's long enough. It's about the fact that you'll get to wear your nice clothes again. You'll get to go out and have fun. Please trust me. Please listen to these videos. It is life-changing. Sure, it's difficult to manage it and deal with it, but in all honesty, it's not difficult to feel fabulous again. So you do it with pleasure. Just a quick last example. I developed allergies, and people would say to me, "Oh, what are you allergic to?" And I said, "No, just about everything." And that's part of my MCAS, is the severe anaphylaxis. And people would say to me, "Oh, but don't you miss eating those foods?" And I go, why would I miss putting a food in my mouth that just about kills me whenever I do it? Like, of course I don't miss it. I actually enjoy not eating it. Like, I don't feel like I'm missing out, because that in my body just doesn't work. It's like saying to someone with diabetes, type 1 diabetes, "Hey, here, just have some more sugar, have some more sugar, have some more sugar. Why don't you have sugar? Just eat sugar, you'll be fine." And you'll know sugar will put you into a diabetic coma. Like, once you understand a biological, biochemical, immunological illness in your body, and you understand how it functions, you then can tame it, and you can then live with your symptoms and live a normal life. And that's what you have to do with these conditions, because now that it's switched on in your body, it's not going away. You have to learn to live with it. And that's what I'm going to now teach you to do. And you will go out and get your life back. You'll make new friends. Your old friends probably won't come back because they're lost for the cause. That's fine. I don't get upset about all the friendships that I've lost, because I just think they didn't have an understanding, or they couldn't deal with the fact that I couldn't explain my symptoms, and that I wasn't the same person I was before I got my symptoms. I meet new people every day, and I make new friends all the time, and it's wonderful. And so I'm not lacking. I'm not lacking in friends. I'm not lacking in social and, social visits and things. It's a new life. You just move on. It's the next day, and you can be happy and pain-free. And I'm going to teach you how that's all going to happen. So thanks for listening. It's long enough, 9 minutes, time to go. Bye.